Everyone, and good morning. We're going to be talking about corrosives today, and I'm Dr. Ramsha. We're going to be particularly talking about mineral acids, vegetable acids, and plastic alkalis. These are the three things, the three main categories in corrosives that we need to talk about today. Each one of them has some various examples in them that are important for you guys to know about. So let's start with the corrosives. Okay. So these would be the objectives for today's lecture. By the end of this lecture, you'll be able to just know about all of these things. What exactly is a corrosive? It's any chemical or any substance that can cause dissolution, a gradual wearing away of a body surface. We're talking about the human body in particular. So, with okay, but so with the chat box, your voice is not there. Okay.
जी आपकी आवाज क्लियर नहीं हो रही है आप इंटरनेट की
अच्छा क्या हुआ एक मिनट अब क्लियर है अब is it clear now? Is it clear now? अब ठीक है? Anyone reply me? ठीक है? चलिए ठीक है फिर let's continue. So now the corrosives can be classified into mineral acids, organic acids, vegetable acids, and alkalis. These are the four broad categories for corrosives. So whenever we talk about corrosives, you should think of mineral acids, which include sulfuric acid, nitric acid, hydrochloric acid. Now, mineral acids are the most damage-causing acids, basically. Most of us have heard about the sulfuric acid or the hydrochloric acid, right? Then comes organic acids. These include oxalic acid, carbolic acid, acetic acid, salicylic acid. Then there are vegetable acids that include hydrocyanic acid and cyanides. These are also very famous, right? Most of you might have heard about cyanides, right? Then, lastly, there are alkalis that include caustic potash, soda, ammonium hydroxide. These are all the alkalis and their salts that we need to talk about. So let's move on. This was a brief introduction. So mineral acids and strong alkalis. These are the two things that go hand in hand. They both are corrosives. However, if they come in contact to the body in dilute solutions, they're going to act as an irritant. They're not going to cause a dissolution of the body surface that they come in contact with, but they're going to irritate the surface. Signs and symptoms of overdose or ingestion of both of these groups are very similar. That's why we've grouped them together, the mineral acids and strong alkalis. And they mainly act locally because they're so corrosive in nature. They just damage the tissue they come in contact with. Like if someone has ingested it, so the tissues of the alimentary tract would get in contact and get damaged. And maybe if it gets to the respiratory tract via aspiration, it can damage the respiratory tract as well. So what is the main mechanism of action? So there's no systemic action. Just be clear with that. Because they're so locally destructive that our body doesn't get a chance to get it into the blood and finally, have its systemic effect. We only have a localized effect. This is characterized by extraction of water from the tissues, immediate extraction. This leads to coagulation of the cellular proteins. And lastly, the hemoglobin in the tissues is converted to hematine. This is a dark pigment that contains higher iron in its ferric state. Okay? hemoglobin just gets oxidized by the strong action of the mineral acids or alkalis, and then it causes it to convert to hematine. So the three main actions would be extraction of water from the tissues, coagulation of cellular proteins, and lastly, conversion of hemoglobin to hematine. Now, what are the general signs and symptoms? The immediate, okay. Is it possible that we could have your email address or further info? Yes, sure. Let me type. Okay, what happened? What's happening? Why can't I type here? Okay. I'm typing down my email address. Wait. Okay. Okay. So this is my email address. You guys can contact me whenever you like, and I'll get back to you. Okay. You're most welcome. So we were talking about the signs and symptoms of acute ingestion. Okay? These are all acute symptoms which develop soon after swallowing. There would be a burning sensation in the mouth. There would be the burning would be up to the throat until till the stomach, like everywhere till the poison can reach, basically. The immediate effect would be the patient would complain of intense thirst. They get very, very thirsty. Okay? They have difficulty in swallowing because of the localized edema, and that is followed by continuous retching. Now, what is retching? You can say it's continuous vomiting. Uh, like the patient just wants to vomit everything out. Okay. Now, after these vomiting episodes have been prolonged, after several period of time, there would be some blood as well in the vomits. Obviously, because someone has ingested a corrosive, there is localized damage to the tissues. Obviously, blood vessels can leak out, and the vomitus would have blood in it. Lastly, there would be signs of corrosion within the oral cavity. Okay. So now we've just grouped the corrosive mineral acid ingestion and the alkali ingestion separately, because the signs and symptoms you get in the GI tract are different. All right. For both of the things, mineral acids and the alkalis, the tongue would be swollen. All right. But in case if someone has ingested a mineral acid, for example, like sulfuric acid, the bowels are constipated and the urine is scanty. Okay, like everything gets low. They're constipated, so they cannot just do their stuff. And however, in cases with alkali ingestion, the opposite happens. There's anesmus. Uh, can you guys hear me clearly? Because I guess my internet connection is a bit unstable. I just showed a message. Can someone just type in that they can hear me clearly, everything's fine? Anyone? No, you can. I mean, the voice is not very clear. Okay, the voice is not clear. Is it clear now? Is the voice clear now? Type in quickly, guys. Please type in quickly. Is it clear now? There is some murmur in your voice. I'm really not sure how to get to this murmur. अच्छा internet connection का कुछ है. Speak a bit louder. Okay, I'll try to speak a bit louder. Thank you. Uh, so, wait. What just happened? हम थोड़ा आगे चले गए. Just a second. Okay, so we were talking about. Great. My system is working right now. Please. 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 Okay. So we were talking about the alkali ingestion. For corrosives, it's everything that's low. The patient would be constipated, urine would be scanty. However, in alkali ingestion, there would be tenesmus. What do you mean by tenesmus? It's like you just always want to go to the washroom because you're feeling unsatisfied, right? It's because of a localized irritation of the GI lining that causes it to just go crazy, and there's rapid peristalsis that causes immediate flushing out of the GI contents. Then there would be some. Now, if the poison gets into the respiratory tract, there would be some problems with breathing as well, right? The first thing that we need to talk about for the symptoms is dyspnea if there is the respiratory tract involvement. Now, this happens usually because the acid can touch the glottis and cause edema of the glottis. Okay, uh, even if it doesn't touch the glottis, it may be because of the volatile nature of it or the strong fuming that's happening with. If you've seen sulfuric acid, you might know that it fumes a lot, right? So those fumes can irritate the glottis and cause edema. This can lead to rapid dyspnea, right? Then another thing that can happen is shock. Systemic failure of the organs die, hypovolemia, the blood pressure falls, and that's what we call shock, right? We're not going to go on which type of shock it is particularly. Just keep it in your mind that it's a shock that causes a collapse. There would be pale face, sunken eyes, dilated pupils, rapid feeble pulse, sighing respiration. Now, these all are the signs of dehydration, basically, right? Pale face, sunken eyes, rapid feeble pulse, right? Cold, clammy skin, dehydration can cause all of that. And if you remember, in cases of alkali, there would be tenesmus and vomiting as well that can cause dehydration. In cases with mineral acids, there's vomiting, right? That can cause dehydration. Now, consciousness is usually retained because they don't act systemically, right? They're just acting locally within the GI lining. So the patient is conscious and it's very painful. So the death, if occurs, it may occur from a primary shock, or it can occur from edema of the glottis that can cause suffocation. Okay? The glottis can get so edematous that it can block the airway tract and leading to death. Or it can happen because of the perforation of stomach that can lead to the getting a leaking of the stomach contents, which also has acids in them, and that can just melt away all of your organs, right? So that can happen. Now, if the quantity of the poison was small, let's suppose, then it may not immediately occur, but something that's called a hypostatic pneumonia may develop. Now, what's in hypostatic pneumonia? It's just basically that the fluid gets accumulated within the lower surface of the lungs, and this can cause problems with breathing, and then that can lead to infection, infectious pneumonia, and ultimately death, right? So, if someone recovers from this episode, then there is a very high likelihood that they can get esophageal strictures, and that can lead to emaciation and malnutrition, and then death over a long period of time. But esophageal structure is a very common complication with corrosive injection because these are very damaging to the local tissues. They cause scarring, they cause damage. Finally, when that damage heals, there's a stricture formed. Now, let's talk about the treatment. The first and foremost rule for any corrosive treatment is no stomach tubes or emetics. Now, why? Why don't we use a stomach tube to perform a gastric lavage? We could easily just pass down the stomach tube and take out all of the gastric contents, and everything would be good to go. We can just wash the stomach with any alkaline solution or something, and everything would be fine, right? Or we can use emetics to just get it out all of the system, right? But we don't use it because there is a very high likelihood of perforation. The epithelial lining of the GI tract has already been damaged to such an extent that it can perforate at any moment, right? And if we insert a tube, it can further worsen or it can actually cause perforation. So we don't do that, right? Now, what can we do instead is that something called a Levine tube can be inserted, right? But that too can only be inserted in the first hour of ingestion, right? Why in the first hour? Because in like the early phase, the damage is not that much that the lining gets weakened, right? Now, if an acid is ingested, what would be the most likely thing that would counteract an acid? It would be an alkali, right? But a strong alkaline carbonate is contraindicated. Okay, why? Because alkalis have the same damage as a strong acid. However, we can use a weak alkali, right? Weak alkalis can neutralize the acid, the strong acids, right? Not strong alkalis. Remember that. Only a weak alkali that has, or an alkali that has been diluted, we can use that to neutralize it. Or we can use milk or egg albumin to just, soothe the surface. Now, in case of an alkali, likewise, we can use a weak acid to neutralize it. Okay? We can give morphine for the pain because the patient would be in great pain at that time. Ice can be used to prevent thirst because they feel very thirsty. IV fluids for dehydration, and steroids can be used for shock and to prevent the esophageal stricture that we were talking about. So early on steroids can be helpful in the long run. Okay? And you may need to perform a tracheostomy as well. Now let's talk about the postmortem appearances. They are mainly just, if you just imagine someone who's ingested a corrosive, what would be the immediate thing? Let's start with the oral cavity. The oral cavity would show ulceration. There would be extensive damage in the oral cavity. The tongue would be deteriorated. Why? Because of the local damage, right? Lips would be burned. Inside, if you go in, the esophagus would be plainly damaged. The stomach would show signs of extensive damage. There might be localized patches. There might be generalized areas that show extreme ulceration. Okay, so I don't know how to. So whoever has just raised their hand, you can say anything that you want in the chat box. Okay, so then comes if there has been respiratory tract involvement, we can irritate it. We can irrigate it. I'm sorry, it's written irritation. Sorry, this is right. You can use egg or nitric acid. Okay. And what did I just say? Sorry, I'm really sorry. So irritation of the respiratory tract and found in cases of volatile poisons, egg and nitric acid. Okay. So if there is respiratory tract involvement, you can use steroids. You can give 100% oxygen just so you can supplement it. Okay? Now, let's talk about the medical legal aspects. Who can use a corrosive? Okay. Now, suicides are not very common because they're very painful. A corrosive ingestion is very painful. There's extreme vomiting, there's extreme thirst, there's extreme pain, there's bleeding, there's blood. It's very bad, right? So people don't use it for suicides. It's not used for homicide either. Why? Because it's something you cannot, uh, deceive someone into taking it because it's very painful, right? No one would be able to make someone drink sulfuric acid. Okay? The only thing that happens with these corrosives is something called vitriolage. Now, this is very common among our society, especially in the interior Sindh areas, probably, or the low socioeconomic areas. This is when someone throws acids, strong acid or strong alkali over someone. This act of throwing acid is known as vitriolage. This can cause severe and extensive burns and injuries and may even lead to death, right? So the definition would be simple throwing of any corrosive. Most commonly, sulfuric acid, which is also known as oil of vitriol, is used for this purpose. And vitriolage can cause extensive damage. It can lead to destroying of vision permanently and permanent facial disfigurement, right? So the main characteristics if someone just throws acid would be severe burns, discoloration of skin, there would be trickle marks, absence of, there would be red lines. You can imagine what happens when someone gets acid, God forbid, on their faces. What happens? Yeah. So what would be the immediate treatment that we can do with such acid victims? Immediate treatment is washing away the acid with large amounts of soap and water. All right. You can also use dilute solutions of sodium or potassium bicarbonate. These dilute alkalis are used in an attempt to neutralize the acids, right? Then, followed by extensive washing, you can layer it with magnesium oxide. The raw surfaces can be covered with Antidote. It should be treated with and water, and you can olive oil into the eye. However, with such patients is very bad. It leads to permanent disfigurement. All of these steps that we take are usually not sufficient enough to save the victim from the permanent damage. That's a button. Okay, so that's all for mineral acids and alkalis. Okay. The only difference between the two is with mineral acids, there's constipation, scanty urine. With alkalis, there's tenesmus and too much urine. Okay, so all of the other things are the same. Then comes vegetable acids. Now these include hydrocyanic acid and cyanide. Cyanide is very famous. It's one of the very famous drugs that people use to attempt or commit suicide. Now let's talk about how does it have its lethal effect. People can die within seconds of ingesting cyanide or hydrocyanic acid, right? So what exactly happens that they just die immediately? So basically, it's a protoplasmic poison, meaning that it acts on the protoplasm. It mainly acts and inhibits the cytochrome oxidase system. All right, this is basically present within our mitochondria, and these are mainly responsible for oxygen utilization. Okay, the cytochrome oxidase system. When this gets inhibited, you cannot utilize oxygen, you cannot produce ATPs, and finally death would occur because of cytotoxic anoxia. Okay. Now, what do you mean by cytotoxic anoxia? Anoxia is lack of oxygen, right? And cytotoxic, you can take it as it's happening at a cellular level. It causes damage or it is lethal to the cells. So you're going to name it as cytotoxic anoxia, right? This was for hydrocyanic acid. Then for cyanides, they also inhibit the cytochrome oxidase system. However, there's a cherry on top for cyanides. They act as corrosive as well, right? So hydrocyanic acid, it's basically a colorless gas. We're talking about hydrocyanic acid and not cyanide right now. Remember that. So hydrocyanic acid is a gas, and it has a very peculiar odor. It has an odor of bitter almonds, right? You can, whenever you come across a dead body and you can smell these bitter almonds from that dead body, think of hydrocyanic acid poisoning or cyanide poisoning. Both of them has this bitter almond smell to them. And this gas that we were talking about, the hydrocyanic acid, if it's in liquid form, can be highly volatile. Now, how does this hydrocyanic acid works? Basically, it combines with bases of several metals or strong alkalis and to form cyanide. Now, there's a chemical reaction that needs to take place uh, by interaction of it with metals or alkalis to liberate cyanide within the system. Okay, so that is why it does not have the corrosive action that cyanides have, because it is having cyanide in it, but it needs to liberate it via a chemical reaction. So let's suppose now we're going to be talking about hydrocyanic acid, which is a gas right now. So if someone inhales the gas, it will be instantaneous death. If someone ingests liquid hydrocyanic acid, there would be an interval of a minute. Why would there will be this interval? Because hydrocyanic acid needs to just liberate itself with those reactions that we were talking about to deliver cyanide. Now, with a small dose, let's suppose someone takes a very, very, very small dose. The individual would first experience headache, confusion, there would be some nausea, loss of muscular tone, and then finally he's going to die. All right. Now, let's suppose if someone ingests salts of cyanide, for example, potassium cyanide, the symptoms would appear about 10 to 20 minutes after the injection. Why? Because it needs to be acted upon by the HCl, which is present within the stomach, to liberate the hydrocyanic acid. Okay? Now, these are something that you don't need to remember. These are the fatal doses, but this you don't need. I'm just giving these to you for your information, but you shouldn't be remembering them. Don't worry about them. For fatal period, you just remember it's immediate. Okay. Now there are exceptions. I'm sorry. There can be exceptions when, for example, if there's hydrocyanic acid that has been taken, then it would take about a few minutes, probably around 10 minutes, to cause death, because it needs to convert itself into cyanide. Remember, it needs to interact with some alkali or some metal within the body to liberate cyanide. Or in case of potassium cyanide, what happens is the HCl needs to act upon it to liberate the hydrocyanic acid. Remember? So that can take a bit of time and can give you around 30 minutes to live more. Now, treatment. If someone has ingested cyanide, no treatment at all. Why? Because death is immediate. However, as you've seen here in the last slide, that in some cases you can get a window. So we can act mainly by reversing the cyanide cytochrome complex that has been formed. How are we going to do that? There's something called meth hemoglobin. Remember? So this meth hemoglobin has a higher affinity to cyanide as compared to the usual hemoglobin. So what we do is we convert the hemoglobin into methemoglobin so that cyanide would interact with the methemoglobin and form a cyan-methemoglobin complex, which is non-toxic, right? Now, if someone survives for 4 hours with this treatment, he's probably going to survive, right? So the only antidote that I want you to remember for cyanide poisoning is dicobalt tetraacetate. Okay, you can forget everything that's written here. Just remember dicobalt tetraacetate. This is used to counteract or convert hemoglobin to methemoglobin, and this is a possible antidote for cyanide poisoning. Dicobalt tetraacetate, right? And you can also use 1% of sterile solution of methylene blue, but the most famous one would be dicobalt tetraacetate, right? Just if someone asks you for the antidote of cyanide poisoning, remember dicobalt tetraacetate. All right, so then comes in case of potassium cyanide or dilute hydrocyanic acid poisoning, you can do a stomach lavage with sodium thiosulfate. You can wash the stomach, and followed by this, you can give potassium carbonate as well. Now, in cases of, since hydrocyanic acid is a gas, remember, so in cases of inhalation, firstly you need to remove the source, and you can add in artificial respiration with 100% oxygen as a treatment. You can administer sodium nitrite or sodium thiosulfate IV, but usually this is not enough to save a person's life. Now, postmortem appearance. Externally, the body would smell of bitter almonds. This is the most characteristic thing that can lead you to your diagnosis of cyanide poisoning. The body may show irregular pink patches, skin may be cyanosed, nails will be blue, fine fluffing in the mouth, dilated pupils. So basically, it gives you a picture of the body was deprived of oxygen, right? Cyanosis means lack of oxygen, remember? Blue nails, same thing. Frothing can occur if someone has died of asphyxia. So that can also indirectly lead you to something that's related to lack of oxygen. But if you remember the bitter almond smell from the body, even if you don't remember the rest of them, you'd be good to go. Because the question for any cyanide poisoning would carry the smell of bitter almonds. This is very characteristic. Okay, so why there's frothing? Well, because of a generalized vasospasm, I'd say. I'm really not sure why there is frothing, but this is what we encounter at autopsies. The mechanism of frothing is not known right now. I'm really sorry. I need to Google it. Why don't you guys Google it right now? Just a second. All right, I'm so sorry. So we were talking about internally. On autopsy, when you dissect the body, what will you encounter internally? there would be again a very characteristic smell of those bitter almonds from the stomach, brain, serous cavities, everywhere. Mucous membranes of the stomach would be pink. Why? Because of the sign mechanism formation if there has been any treatment involved. Okay. Then comes the blood-stained broth, which would be originated within the trachea and bronchi, petechial hemorrhages in the pleura and pericardium. Brain meninges would be hyperemic. If potassium cyanide is taken, there will be corrosion of mouth and frank blood in the stomach, okay, due to the corrosive effect of potassium cyanide, right? So this was for now medical legal aspects. The most important one is that they are a very good option for suicidal agents, and normally cyanides are used in gardens and photography. So accidental poisoning can also occur. Like for example, if someone was using it for fumigation and they accidentally inhale it, then that can lead to accidental poisoning, right? Homicidal poisoning is rare but can happen as well. So that was it. We've reached the end of the lecture. Thank you so much. Any questions so far? Any questions, anyone? We've got 232 participants. Anyone with any questions, or should we call it off? Why? What is frank blood? Frank blood means visible blood. Frank means what should I say? Like it's evident that it's blood. It's not mixed with anything. You can see it very clearly that this is blood there, right? That's what frank blood is. Are corrosives and toxins different? Well, yes, they are very different. Corrosives are your most welcome Pakya, and for Minha, corrosives are just what we talked about. They have just they cause dissolution on the surface basically. And as for toxins, our body has generates toxins on a daily basis. We get rid of the toxins via our urine, via our GI tract, via our sweats. So toxins are something they're part of our body basically because we generate them daily, right? Why there is death within 2 minutes in cyanide poisoning? Because of the rapid inhibition of the cytochrome oxidase complex within the mitochondria. You cannot utilize oxygen at a cellular level. You can breathe in oxygen, but you cannot utilize it. Your cells cannot utilize oxygen. But you need oxygen to survive. Remember, all of the cellular functions happen because of oxygen. The mitochondria generates ATP with the help of oxygen, and that's what makes the cellular functions go on, right? So if you're going to inhibit the cytochrome oxidase system, the main ATP generating mechanism within the mitochondria, obviously there would be death immediately, right? Any more questions? How could cyanide reach the cells of vital organs in 2 minutes? Well, because of its rapid bioavailability, I'd say. It can just diffuse into the blood very easily. That's why. Any more questions? You're most welcome, Sama. So I guess that's it. We can call it off. And thank you so much. Nafis. Okay.